Assalamu alaikum. Glad that you are online with me. I'm Dr. Amina Binsy, working at Naseem Al Rabeeh Medical Center, Al Rayyan branch. Today I'll be talking about a topic which is the commonest malady of adolescence, that is acne. Acne is such a common disorder that even you can consider it as a physiological process, but better be regarded as a disease due to the inflammatory component and the disfigurement which it can cause on our face. There is no exact definition framework for acne, but what I can tell you is that it's a chronic self-limiting inflammatory disorder of the pilosebaceous unit characterized by polymorphic skin lesions in the form of comedones, papules, pustules, nodules and cysts, and they can even go for extensive scarring. Acne, there are numerous variants, but to keep our talk simple, I'll be talking about the commonest variant, that is acne vulgaris. It's not that acne affect only the adolescent age group. It can come in any other age group like any other disease. The peak incidence of acne in women is between 14 to 16 and men is between 16 to 19. Patients come to my clinic and ask me, why do I get acne? What is the cause for my acne? And the answer is, it's multifactorial. Even you can blame your gene for your acne, because studies have shown that children with acne have one or both the parents with acne. Your environment, your stress, your strain, the quality of hormones, especially the androgen, the quantity of sebum produced, then the follicular hyperkeratosis. There are lots more in the list. People are more concerned in the area of diet and acne. They blame chocolates, fatty food, oily food, and ice creams for their acne. There are lots of myths and notions in regard to acne. I personally feel that it's inappropriate to dogmatically reject the role of diet in acne. So what I tell my patients is that to avoid whatever food they feel is responsible for their flare-up or development of lesion. Now, talking about the clinical manifestation, acne is seen in the seborrheic areas like face, mid-chest, back, upper arm and shoulders. It's very interesting to note that other seborrheic areas like groin and pubic region are usually devoid of acne, probably because of the presence of terminal hair with large biliary canal. Now, depending upon the severity and for clinical assessment, there are 4 grades in acne. Grade 1 is characterized by comedones and few papules. Grade 2 is characterized by comedones, papules and few pustules. Grade 3 is characterized by predominantly pustules and few nodules. And grade 4 is the nodulocystic variant of acne, which is the one which leave behind scars. The usual type of scars seen are atrophic scar, hypertrophic scar and keloidal scar. Atrophic scars are again like rolling scar, ice pick scar, box scar, etc. And I wanted to add up something regarding the comedones. Comedones are the primary lesion in acne. You should never neglect a comedone, because comedone is the one which can become a papule. A papule can in turn become a pustule by the action of bacteria, and pustule can become a nodule, and nodule can become a cyst, and they can go for scarring. There are different types of comedone, and the commonest one are open comedone and closed comedone. Open comedone is the blackhead and the closed comedone is the whitehead. Blackhead is black in color because of dirt. Actually, it's a myth. It's black in color because of oxidation of melanin due to the presence of certain sebum, lipids in the sebum, and due to reflection of light through the compacted cells. And the closed comedone or the whitehead can be seen only when your skin is stretched. Usually acne goes for remission in late 20s or early 30s. If acne persists beyond 30s and if you find acne in elderly individual, you should definitely have a hormonal workup done. Acne has a huge psychosocial impact in the individuals in the form of depression, low self-esteem, lack of self-confidence, even suicidal ideation. So prompt and effective treatment will help to overcome this to a great extent. So talking about the treatment, we do have various modalities of treatment available today. The duration and outcome of each treatment vary from patient to patient. So each doctor will have their own personal strategy in treating their patient depending upon their need. Patient education plays a very important role in treating acne cases. First and foremost, we should take away all the myths and notions in regard to acne. Then ask the patient to use an anti-acne face wash gel twice daily, not more than that, only twice daily. And they should use products which are suitable for their skin type. Especially if you are having an acne-prone skin, you should go for something which is a gel-based or a water-based, especially sunscreen and moisturizers. You should have a sunscreen even though if you have acne on your skin. Then you should keep your skin hydrated by drinking lots of water. You should always adopt a healthy eating habit and avoid fatty food and food which is having high glycemic index, and reduce the usage of milk and milk products, because studies have proven the effect of high glycemic food and milk and its milk products in the development of acne lesion. High glycemic foods are those foods which increases your blood sugars rapidly. Once you take such kind of foods, what happens is that in your blood there is a condition called hyperinsulinemia, which results in increased secretion of androgen from the gonads. There is increased sebum production, which will in turn results in acne. So try to avoid such food items. Then never ever pick your acne, because picking acne will result in formation of scars and newer lesions will develop. Then I wanted to add up, you should avoid comedogenic cosmetics, you should avoid acnegenic drugs, oil application, pomade application. Now coming to treatment, we have two lines of treatment, either a medical line of management or cosmetic or surgical line of management. Medical line of management, we treat our patients with topicals and systemic. We do a monotherapy or a combination of both. The target is to reduce the sebum production, reduce the follicular hyperproliferation, against the bacteria, against the inflammation, and against the hormones. So it's all depending upon the patient need, we do our treatment plan. And talking about the surgical or the cosmetic ones, we have in our clinic, we do subcision, we do radio micro needling, we do microderm abrasion, then we have lasers, we have chemical peel, the most famous one or the most popular one, then we have fillers, then we do intralesional injections, then we have phototherapy, many more. And if you have any concerns or queries or questions, please do visit us, our clinic. We'll be very happy to address all your concerns in both clinical and cosmetic dermatology at our clinic. That's it. Thank you. Bye.